details. And can you verify your name for me, please?
Jessica Connor.
Jessica, today I'm going to be your nurse and I'm going to be conducting a survey, a general survey. I'm going to be doing your vital signs and I'm going to be doing a skin assessment. Um, the skin assessment, it does involve me inspecting and palpating your skin. So I would like your permission to get partially undressed while we conduct that examination. Do I have your permission?
Yes.
Okay, thank you. And Jessica, as I walked in the room today, I noticed that you were smiling. Your mood and your affect seems appropriate. Um, you dressed appropriately, okay? Um, we're gonna be starting the examination with your vital signs, okay? All right. So I'm gonna do your apical pulse for 1 full minute using the landmark, um, the third intercostal space at the left sternal border for 1 full minute. All right.
Okay.
I'm gonna wash my hands and we're gonna get started. Okay? Are you okay? All right. We're gonna get started. Um, we're gonna check. We're gonna check your pulse. Just relax and breathe normal. Okay. Your blood pressure is 110/70 and your respiratory rate is 16 within normal limits. Both are within normal limits. Do you mind laying back for me, please? Okay, so we're gonna start today. I'm gonna move forward with your blood pressure and then we're gonna move into the skin assessment, okay? We're gonna let me just make you a little bit more comfortable and put your arm just to relax a little bit. Just relax. You break your pulse and we're gonna get started. You can lay back, it's okay. Okay, your blood pressure is 110/70, and that's within the normal limits, okay?
Okay.
It's right here. Alright, Jessica, the next step, I'm gonna cover you a little bit so that to protect your privacy, and we're gonna cover. Okay. I'm gonna start the assessment process, okay?
Mhm.
So we're gonna start with your face, and we're gonna be looking for like any lesions, any discoloration in the skin, um, any skin rashes, and right now I'm examining your face, and I don't see any lesions or any skin rashes or any discoloration to the face. So I'm gonna check your head, and I'm gonna be inspecting your head actually. I'm gonna inspect your head and I'm gonna palpate. So I'm gonna be using my hands today. The history doesn't suggest any lice or anything, so it's okay, is it okay for me to use my hands
Yes.
in there? No gloves, or do you want me to?
Oh, it's fine.
Okay, so we're gonna go move forward and we're gonna palpate the scalp for any lumps or bumps, and we're gonna inspect for any redness or any rash or any lesions, and I don't see any, it's normal. Um, then we're gonna move forward to the chest area. Jessica, do you mind putting your arms down and just relax a little bit? I'm gonna remove your
Okay.
top a little bit, okay? Alright, Jessica, I'm inspecting your chest right now for any redness, any rashes, any obvious lesions, and I don't see any on the chest area. I'm gonna check your arm, and I don't see any lesions, no redness, no rashes or anything like that. Um, your hair distribution seems evenly distributed, and that's within the norm. I'm gonna check your elbow area, because sometimes bedridden patients can develop like blotching of the skin or redness on the elbow area, because that's a pressure point area. And right now I don't see any of that. Let me check the other one, please. Thank you. There's none there. And I'm gonna check your temperature by the back of my hand, both sides. The temperature is normal within the like it feels warm and dry, and no obvious redness or skin um, lesions or any of those things noted. Um, I'm gonna check your nail beds. Like, I'm gonna check your right side, and then I'm gonna check your left. This is the left actually. I'm gonna there's no clubbing or no discoloration, and your capillary refill is within the normal limits, less than 2 seconds. That's fine, and now I'm gonna cover you back, and then it's okay for me to remove the other half? Okay, so we're gonna go down a little bit, and it's okay?
Mhm.
Alright, so then I'm gonna check your abdomen. For the purpose of this video, we're not gonna remove your clothing all the way, but in a normal setting, we will check your abdomen for the same thing. I'm looking for any lesions, any discoloration, any rashes, anything obvious or anything that would be considered abnormal. And then I don't see anything there that's within the normal. It's warm, skin warm and dry. I'm gonna move forward with the examination of your thighs, and I'm gonna come forward because I don't see any redness, any rashes, any discoloration in your leg area, and so I'm gonna bring the cover back, and I'm gonna remove the bottom half of this. Do you mind? Alright, so I'm gonna check your legs, and we're doing the same thing, okay? We're continuing the examination. There's nothing going on, no swelling, and no redness in the skin. The skin is warm and dry, and no swelling going on there. And for the normal examination in a hospital setting, we would ask you to remove your shoes, but for this purpose of this video, we're gonna just leave the shoes on, but we're gonna let our instructor know that we would otherwise examine your nail beds. We're looking for the same thing. We're looking for your cap refills. We're looking for any clubbing. We're looking for any discoloration in the leg, the ankles, and the feet. We inspect the bottom of the feet. There's no lesions, no redness, no discoloration on the ankles, the feet. At this point, our examination indicates no abnormal findings. So anteriorly. And so we're gonna go ahead and ask you to roll onto your left side, and we're gonna do a posterior examination. Is that okay? Do you mind if I put it on? Okay. All right. So, so Jessica, we're gonna do the same thing, starting with the head, and we're gonna move towards your feet, okay? And I'm gonna inspect the back of your head, because sometimes this is a pressure area where a patient's bedridden. They're laying on the back of their head sometimes, and they develop some redness in that area. So I'm gonna inspect, and then I'm gonna palpate, okay?
Okay.
All right, so I'm gonna look for any redness or any discoloration, no lesions, and no redness also in the back of that area. And so no abnormal findings so far, okay?
Okay.
And so I'm gonna move for, at this point, I'm just gonna check your ears, the earlobes, and sometimes our patients, sometimes when they're on like oxygen, they sometimes develop some redness to the back of the ear, this pressure point area also. And since you're not an oxygen patient, you don't have any redness to the earlobe, you don't have any redness in the back of the ear, because no, you're not on any oxygen also, but just being on the safe side, examine all of that. So come down, the back of the neck doesn't have any redness or any lesions or rashes or anything like that. We're also, right now, we're gonna move forward to the shoulder area and inspect the spine. The shoulder area is already also problematic, because that's pressure point area. We're gonna examine that to make sure that there's no redness, no blotching of the skin, no skin tears, no breakdown or any of those things. So I don't see any redness, no blotching of the skin, no lesions, no obvious rashes. So we're gonna move forward to the spine and do the same thing, okay? And so far, I don't see anything there. The skin is warm and dry, and no lesions or any rashes or any skin tears or anything like that is noted. We're gonna inspect your sacral area, and the sacral area is also a pressure point area, but there's no redness there. I didn't see any redness, no skin tears, no blotching of the skin, no lesions, no rashes. So I'm gonna inspect the hip area. The hip area also, I don't see any rashes or any lesions or skin breakdown or any pressure point like blotching of the skin or any of those things. So that appears to be in the normal, within normal limits. Also, for the purpose of this video, we're not gonna inspect the coccyx area just for your privacy, but we'll let our teacher know that we would otherwise do this in a normal environment, because this is our patient in the hospital setting. But since she's not in a hospital setting, I'm gonna protect her privacy and not do that, but just note that this would be done otherwise if the patient is in a hospital environment. So we're gonna continue down the examination with the thighs, the back of the thighs. We don't see any redness, no swelling, no discoloration, no rash or anything. That seems normal skin tone. And then the back of the legs is the same thing, like I tried. There's no rash. There's no rash, no lesions, no skin tears, none of that. I'm checking now for any. Do you mind laying on your back for me, please? And then I'm gonna check your leg. There's no swelling there. I don't feel any. No swelling, no rash, no discoloration, no lesions. And for the purpose of this video, I would allow you to keep your shoes on, but in a normal environment, hospital setting, we would ask you to remove your shoes and we would inspect your your toes, your nail beds for any clubbing, any discoloration, and also check your capillary refills. And right now, I would say that that's within the normal limits for the purpose of this video. Also, I checked the bottom of your feet and I don't see any redness or rashes for the purpose of this video. There's no redness or any rash or discoloration noted to the bottom of the feet. We also have like pressure points in the ankle, and so I don't see any redness also as I inspect that area. There's no redness. The skin appears um, pink, warm, dry, and pink. Right, Jessica, this concludes our skin assessment, and
Thank you so
I
much.
hope you follow up with your primary care doctor and give us the opportunity if you're ever needing to see a primary care or a ER visit, just come see us, okay?
All right, thank you.